Hi everyone, in this video I'm going to discuss a very interesting problem that is love sickness. Well, it is also known as puppy love or limerence. It's a condition characterized by intense feelings of infatuation and longing for another person. The condition is not officially recognized as a medical disorder, but it can have significant impacts on a person's daily life and well-being. First of all, I'll let you know the symptoms. Well, the symptoms include persistent thoughts and fantasies about the person of interest, difficulty concentrating on other things, anxiety or agitation when thinking about the person, physical symptoms such as a racing heart or butterflies in the stomach, a strong desire to be near or with the person, mood swings and constant changes in emotions, insomnia or lack of appetite, and there could be loss of interest in hobbies or activities that were once enjoyed. Now I'll tell you the causes. Well, the exact cause of love sickness is not fully understood, but it is thought to be related to the release of chemicals in the brain such as dopamine and norepinephrine, which are associated with pleasure and reward. Social and psychological factors such as low self-esteem or a lack of social support can also contribute to the development of love sickness. Some studies suggest that individuals who have experienced a lack of love or affection in their childhood may be more susceptible to love sickness. Now I'll tell you some complications. These complications include depression, anxiety, and difficulties with a personal relationship and daily functioning. In some cases, the condition may even lead to stalking or other forms of harassment. Love sickness can also lead to an obsession with a person of interest, leading to negative consequences in the individual's professional and personal life. Now I'll tell you about diagnosis. Well, it is typically based on the symptoms of a person is experiencing, and there is no specific test for the condition. A healthcare provider may also rule out other possible causes of the symptoms, such as medical condition or substance use disorder. It is important to differentiate love sickness from clinical depression, as the symptoms can be similar. Well, on this channel, there are already very informative videos about clinical depression. You can see those videos. Okay. There are several ways to prevent the onset of love sickness. One of the most effective methods is to maintain a healthy self-esteem and engage in activities that promote self-confidence. Building a strong support of friends and families can also be helpful. It is also important to be aware of the warning signs of love sickness and take steps to address them early on. Okay, this was prevention. Now I'll tell you about the treatment. Well, treatment for love sickness can include therapy such as cognitive behavior therapy or talk therapy, which can help a person learn to cope with the feelings and improve their self-esteem. Medications such as antidepressant may also be used to help manage symptoms of depression or anxiety. Therapy can also help the individuals explore their feelings and understand the underlying causes of their condition. Group therapy can also be helpful, as individuals with love sickness can feel isolated and alone, and it can be comforting to know that others are going through similar experiences. Now I'll tell you some drug doses. Uh, well, if we use drugs, we can use selective serotonin reuptake inhibitors such as fluoxetine that comes with the name of Prozac, that can be used for like in the dose of 20 milligram to 40 milligram per day. Then there is another group of drugs that is known as serotonin norepinephrine reuptake inhibitors, such as venlafaxine that comes with the name of Effexor, that can be used on a daily basis. The dose ranges from 75 milligram to 225 milligram per day. It is important to note that love sickness is not a medical disorder, and treatment should be tailored to the individual's specific needs and circumstances. It is always best to consult with a healthcare professional for guidance. Self-care is also an important aspect of coping with love sickness. Practicing good self-care can help to reduce symptoms and overall well-being of the individual. Now I'll tell you some self-care tips. Um, uh, These are engaging in regular exercise and physical activity, eating a healthy diet, getting enough sleep, practicing relaxation techniques such as yoga, meditation, or deep breathing, avoiding alcohol and drugs, keeping a journal to document feelings and thoughts, staying away from the person of interest, or limiting contact to a healthy level. It is important to remember that love sickness is a temporary condition and with time and support it will eventually pass. It is important to keep in mind that the feelings that one experiences during love sickness are not necessarily a reflection of the person they are infatuated with, but rather a reflection of the individual's own emotional state. With the right support and self care, one can learn to cope with the symptoms of love sickness and move on to a healthier and happier state of mind. Well, in summary, love sickness is a normal and natural experience characterized by intense feelings of infatuation and longing for another person. It can have significant impacts on a person's daily life and well being. The causes of love sickness are not well understood but are thought to be related to the release of chemicals in the brain. Uh, and the treatment, as I already told you, includes psychotherapy, medication, and self care. Well, this was my video about love sickness. I hope you like this video. If you have any question about this, please post your question in the comment section. Thanks for watching this video. See you in the next video. Bye for now.